As chair of the Congressional Hispanic Task Force on Health, I commend Voto Latino and Planned Parenthood for their outstanding efforts to ensure that the ACA fulfills its promise to our Latino communities. Their outreach and enrollment is another example of their commitment to social equality.
ACA provides tremendous benefits to our citizens and legal permanent residents, but it also reminds us of the need to enact, as I just said, comprehensive immigration reform that will put those who are living and working here without documents on a pathway to citizenship and access to affordable care.
A whole big idea of the whole Affordable Care Act was not only get insurance, but actually get preventive care. And for a lot of young people and a lot of young women, that's essentially all we need. I say we. There was a day, which essentially you need your checkup once a year. Your well woman visit. Most women need birth control when they're young, and so getting the access to that care before it's a problem, whether it's early detection of cancer, whether it's getting birth control so you don't have an unintended pregnancy, this is a huge cost saver for the American people. It's a huge public health interest, and it's great for women. And so that's one of the things I think is so important that you can carry this message. So many women still do not know that preventive care is covered for no copay. So we have to get that word out there, because that in and of itself is reason enough for young women, not only young Latinas, but all young women to enroll in the Affordable Care Act.
So trying to get young, healthy people to be part of the system is incredibly important. And we also recognize that Latinos also have highest uninsured rates. And that's in part because they're much younger than the rest of the population. The average American is roughly 43 years old. The average Latino is 26 years old. They're not only at their prime, but they're also the ones least likely to say, I'm never going to get sick. More likely to say, I'm never going to get sick, and less likely to apply.
So one of the most common places that Latinos go for healthcare in this country are community health centers. Out of all the patients at community health centers, 1 out of 3 is a Latino. So when you invest in community health centers and the work they do in our communities, you're investing in the health and well-being of the Latino community.
They're contributing to the fabric of this country, so ensuring that our women are healthy and our immigrant women are healthy is ensuring that our family and communities are healthy.
Our DACA individuals in California can access our Medicaid expansion as of January 1st, 2014. And so that's another place where California has really been pioneering and recognizing that in the absence of immigration reform, we can really do more and figure out how we're going to cover everyone.